February is American Heart Month, when the nation spotlights heart disease, the #1 killer of Americans. Across the globe, nearly 19 million people died of cardiovascular disease in 2019. That's a 17% increase over the past decade, but in most cases, heart disease is preventable. But how? Let's ask the expert. Joining me now is Dr. Sonal Haerter of Dignity Health Medical Group. All right, Sonal, first off, why does it always seem as though there is more attention on women than men during this month?
I'm so glad you asked me that question because about 56% women are aware, which means 44% women are not aware that this is a #1 killer amongst women. So about one woman dies every 80 seconds from cardiovascular event. Whoa. And that's huge.
Yeah.
1 every 5 deaths is from cardiovascular event. And the other factor is symptoms for women can be very different from symptoms amongst men. So a typical heart attack is described as crushing chest pain, goes to your jaw, goes to your shoulder. Amongst women, that can be nausea, indigestion, extreme fatigue, impending doom-like sensation, or anxiety. Shortness of breath is actually very common, and that's how heart attacks can present amongst women. And those symptoms can be easily dismissed as something different. So that's why it's so important that we talk about it and we educate our women that that's how heart attack can look amongst women.
And that's why you have such a big campaign every single February.
Correct.
So you talked about the symptoms. Let's go through the risks. And some of these were really interesting, including gestational diabetes, which is what I actually had when I was pregnant with my twins.
Right. So we know the traditional risk factors both for men and women: smoking, hypertension, diabetes. But amongst women, there's some other risk factors like polycystic ovary syndrome, early menopause. Menopause itself increases the risk. Estrogen is protective towards our heart. And as soon as we get into menopause, your risk goes up just from that one single factor.
Wow.
And then inflammatory diseases like psoriasis or lupus also increases the risk. High blood pressure during pregnancy and diabetes during pregnancy also increases your lifetime risk of having heart disease.
Whoa, that's frightening.
It is
really
frightening.
Okay, so we talked about the women. What do men need to know?
Okay, so men, obviously it's the #1 killer for men as well. And they have similar risk factors to women as well, which is high blood pressure, smoking, being sedentary, or not having optimal weight, diabetes, and all of those risk factors.
Okay, speaking of which, let's go, highlight some specific ones. We just saw, you have to look at your blood pressure goal, your cholesterol, LDL. What about sugar level?
Okay, so you want to make sure that you are not showing signs of diabetes or pre-diabetes, which is if your fasting sugar is above 100, that's abnormal. So check in with your doctor for all these risk factors like what is your blood pressure? What is your cholesterol, the LDL, the bad cholesterol? What number are you at? The desired number is under 100. Your sugars, fasting sugars, should be below 100. So check in with your primary care doctor, your family doctor for all the risk factors.
Which is why, again, an annual checkup is always so important.
So important.
Yeah, it's kind
Even
of
when you're not having any symptoms, it's preventative. 80% of heart disease is preventable if you take care of all these factors.
Right. And there's actually an online calculator to see your risk factor.
Yes.
Tell me about that.
It's called Prevent, and it's American Heart Association website. And if you go in there, you plug your gender, your age, your risk factors, and it gives you a 10-year risk of cardiovascular events. So it gives you a risk of what is your risk of having heart problems in the next 10 years or lifetime risk, which is so easy, and you can actually address that with your doctor. Take that number to your doctor and discuss what you should be doing with those numbers.
Once again, that online calculator is?
Prevent.
Prevent. Okay, perfect. Sonal, thank you so much. So much good information.